I'm Fairdous Alam.
Hi, I'm Dr. Pragati Singh.
And we are Team QRATE. So I'm originally from Bangladesh. So I came to the US for my undergrad as a physics major.
I come from the typical middle-class Indian family where your children have to become doctors, right? And so I had to become one. But then at the same time, in 2013-ish, I was going through my own self-exploration journey of who am I, what is my identity? And that's how I came into a place eventually where I started focusing more on sexual and reproductive health and rights, and then specifically LGBTQIA health and rights.
Somehow from physics, I migrated to economics because I thought, economics is a way of explaining how people behave. And when I started getting more into it, then I understood that behind the stories is always the data. All the tools and techniques of machine learning and AI and NLP that I can actually use to build product which actually has an impact from the theories that I know and that I can actually use to make a change.
Since I've been working in healthcare and on LGBTQI issues in parallel, there was always this stark contrast that I could see between how one is rights-based, one is more technical, and there's this chasm, like there's this gap between the two. This gap was so evident to me eventually that I wanted to do something about it. At some point, we came across FNF's Hackathon, and we decided this is it. This is the time where I need a co-founder, I have an idea, it's applicable. We decided to go for it.
It's very hard to find a team who's really motivated, who has the right experience and complementary set of skills, right? I think we have it in us.
I feel like if we are able to maintain this momentum, there is no stopping us from making this into an MVP and then actually launching it sometime in the next 3 to 6 months. Anybody who needs healthcare access should be able to get healthcare access regardless of their gender, sexual orientation, and other identity markers.